prenatal and postnatal yoga. So, first of all, this lecture is designed for you so that when you have students coming to your open level classes who are pregnant or post birth, you will know how to modify the practice. This lecture is by no means certifying you to be a pre or postnatal yoga teacher, but it will give you some general guidelines and tips on how you can safely guide women in your open level classes when they are pregnant, and we will look at the different trimesters and how you can support them in the best possible way. So generally speaking, when pregnant women come to your open level classes, they will most likely have been doing some yoga prior. So don't stress. Remember, they are not sick. They're just pregnant. And the very first thing that you want to say if a pregnant woman walks up to you, letting you know that she's pregnant, is congratulations. So just remember that. Don't stress. And this is exactly why we have this lecture. You can, of course, only do their best and give you tips and advice, but they are choosing to come to an open level class, which means that they will also have responsibility themselves on how to modify the practice and to be guided by their own comfort. And since you are not a pre or postnatal yoga teacher, this is not your responsibility, but of course, we will do our best to support them the best we can. So just a little bit of background knowledge about me. I have 2 children. I have Matteo, who is a toddler now. So by the time this lecture is being recorded, he is 21 months. And then I have Maya, who is 1 month old. So I've been practicing yoga throughout both of my pregnancies, and I've also, of course, been through the recovery of birth and been using yoga a lot for this as well. So I can speak very highly, and I have experienced it on my own body how yoga can help both prior to birth, during birth, and after. I am really passionate about both prenatal and postnatal yoga and all the benefits that comes along with practicing it during this transformative time in women's life. So really excited to share this lecture with you all. So prenatal yoga is a gentle form of yoga that women can practice throughout pregnancy. So first of all, when a woman comes to your open level class and she lets you know that she's pregnant, do not panic. Also, don't assume that a woman is pregnant if she haven't let you know already. Of course, if she's in the 3rd trimester and she has a really big belly, you will know, but especially in the beginning stages, it can be really hard to see if a woman is pregnant or maybe she's just bloated. So never assume anyone is pregnant. The second thing that you want to ask them is if they have a doctor's approval. You don't necessarily have to ask it, but if they come up to you asking if they're okay to do yoga, this would be a great place to start. So usually if women have a uncomplicated birth, then they're totally fine to practice yoga, and midwives and doctors and physios would often recommend them to practice yoga throughout pregnancy. And then the third question that you might want to approach is if they have any previous experience with yoga. So is this the very first yoga class? And usually if they've never done any yoga before, I would recommend them to join in on a prenatal yoga class, because then the teacher have full attention on them and can guide them safely throughout their practice. But if the yogi have already quite a bit of experience, she will know how she can modify the practice, and she will also know what feels right and what doesn't. And remember, it's not your responsibility in an open level class to keep 100% eye on your pregnant student, but of course we can guide them the best we can. So this is also important to mention to them that if something doesn't feel right, they shouldn't do it, and they should always be guided by their own comfort, and you will do your best to give them the modifications needed. But of course, you also have other students in your class that you also need to pay attention to. So if they come up to you and you already know that you're planning on doing a backbend focus class and that your peak pose is full wheel and that might be too much for the student, you can already by then let them know that we're doing quite some deep backbend, so just make sure not to go too deep, and if it doesn't feel right, sit it out. But welcome them into your practice with a smile and let them know that you're there for them. So if they are at the very beginning of their pregnancy as well, so in the first trimester, then they might not have announced to the world yet that they are pregnant. So it's also important to keep this in mind, that when you're teaching, you are not pointing out in front of other students that they are pregnant. So you don't go like, hey, pregnant woman in the back, don't do this close twist. But you would just be a little bit considerate with how you are guiding them. So in the first trimester, some women don't feel comfortable sharing it with the world yet, as this is the time that there is the highest chance of miscarriage. So often women wait until they are 13 weeks, so just entering the second trimester, to announce it to the world. So that's something to keep in mind. But every woman is different, and some women also announce it a lot earlier. So a woman is pregnant for 9 months, which is divided into 40 weeks. So the first couple of weeks, the woman won't know that she's pregnant, and she would usually figure that out around 3 or 4 weeks, the earliest. So there's of course different stages of pregnancy. There's the first trimester, which runs the first 3 months, and then the second, and then the third. And the yoga practice will vary and change quite a lot throughout the different trimesters, which we will go more specific into. So another important point to know when you're teaching prenatal yoga, also postnatal, is the hormone relaxing. So it is a hormone that is released into the body to prepare the woman for childbirth, and it helps opening up the hips, which is pretty amazing. It's amazing what the body can do, but that also means that we want to be a little bit more careful and mindful with especially deep stretching, as women are more likely to overstretch at this point. So a good guideline that you can give pregnant women is to not go too deep. So if they find that this is the deepest they can go, then maybe just have them lifting up a little and just going a little bit less deep than they would usually do. This is also one of the reasons that I don't recommend women who are pregnant to do hot yoga, as then they are even more likely to maybe overstretching. Some women will also feel pain due to this, quite often in the SI joint, sacroiliac joint, and also experience other pains in the body due to this hormone. So the growing uterus puts pressure on the bladder. So this is a big one as well, especially as women progress through pregnancy. They would need to run to the toilet a lot more often. So keep in mind that if a pregnant woman leaves the class, it doesn't necessarily have to mean that they don't like the practice. They might just have to run to the toilet. Sometimes it can also be helpful for the woman to place a mat quite close to the exit, so that she can easily run to the toilet if needed without feeling like that she's disturbing everyone else. So yeah, just having some understanding on that. If they run out, they most likely just have to go to the toilet. So a couple of the benefits of prenatal yoga is that it can reduce stress and anxiety. So especially first-time mothers, they might be feeling really overwhelmed by not just the physical changes, but also the emotional changes happening. with them. And also due to all the hormones changes, there's a lot going on, and they might be feeling really emotional and not really understanding what's going on with me. So this can really help whatever the woman might be experiencing emotionally as well, not just physically. So it can also help improve the sleep, especially towards the end of pregnancy. It becomes really challenging to sleep. The baby is moving a lot, is putting pressure on the bladder, so it's really important to get some rest, and yoga can give that little rest, especially more restorative classes, and it can also help improve sleep. And then it increases the strength and flexibility needed for childbirth. So throughout the different trimesters, we will focus on different aspects of this. But yoga can really help prepare the woman both physically and emotionally for this big change that is about to happen, and also during childbirth. It can also help decrease lower back tension. So like I briefly mentioned, this SI joint pain is really common, and also just other pains and discomforts in the body. So in prenatal yoga in general, it can really help decrease some of these discomfort. So I used yoga a lot throughout my pregnancies to also strengthen the lower back and stabilizing core exercises to keep my body healthy, because I was struggling a lot with this lower back tension. Well, relatively a lot. I really helped me doing a lot of yoga. It can also help decrease nausea. So especially in the first trimester, but for some women throughout the entire pregnancy, they might be feeling really nauseous, they might be throwing up, and yoga can also help some of these postures. Some of, not these postures, but some of these symptoms. And then it can help foster a connection with the baby, and as we briefly talked about, mentally help prepare the mother for the birth and for the time after. So just taking this time to really slow down and connecting with your body and your breath and your baby. So for me, the second pregnancy, it was super challenging to just take this time, as I had a toddler running around as well that I needed to pay attention to. So my yoga practice during my second pregnancy was really important for me, as it gave me that really needed time to connect with my unborn child, and also just mentally preparing myself for becoming a mother of two. So the first trimester runs from the 1st to the 12th week. And this is the time where a lot of women are feeling really tired, overwhelmed, and nauseous. So in my first pregnancy, I was feeling very nauseous. I didn't throw up much, but I just had this constant feeling of like almost being about to throw up at any time. Didn't have much appetite, and I could eat biscuits and cold smoothies, and then I just couldn't stand the smells of some foods. So for me, the first trimester was really hard. Also because at this point, I didn't announce to the world that I was pregnant, so no one knew apart from my close family. And but it was a time that I was feeling really overwhelmed and tired and nauseous. So I didn't do a whole lot of yoga at this point. I did just some restorative and yin yoga and some very gentle movements. So very often it will be a gentle practice in the first trimester due to these symptoms. So it's also a great time to be gentle, as the fetus is still implanting and the risk of miscarriage is higher. So just a gentle practice. There's no need for jump backs or jump throughs. Just like it's not recommended to jump on a trampoline during pregnancy. We just want to be a little bit more mindful at this point. And yeah, it is a time where there is a lot of hormone and mental changes. So it can be a really overwhelming time. towards the end of first trimester, most women start regaining more energy and they are entering the second trimester, which is also referred to as the golden trimester. Since most women are just feeling a whole lot better in this trimester. So this is also the time that a lot of women will start practicing yoga. They will feel the benefits of moving their bodies. And now the physical changes also start showing. So you will slowly, or they will slowly be showing a little belly, especially if it's a second pregnancy. It happens a lot faster. Where the first pregnancy, sometimes you can't really see it up until they're halfway through at 20 weeks. So at this point, the woman wants to avoid laying on their belly. It's around 16 weeks. So I think for me, around 17 weeks, it didn't feel comfortable more, but it doesn't mean that they're hurting the baby if they're still comfortable laying on their belly. So at this point, you would guide them to take out any postures where they are laying on their belly. This is also the time that the abdominals gets weaker and they start separating to make space for the growing baby, which is really amazing, again, what the body can do. So of course, with a weaker core, they might start feeling some lower back tension. So it's really important to still, with some gentle exercises, to keep the lower back healthy and also stabilizing the core. So now the center of gravity also starts to change. So the woman has most likely gained quite a bit of weight at this time, and also as the belly is growing, balancing becomes harder, and so yeah, it becomes more challenging to do a lot of the balancing postures in the practice. So you can always guide them to use any support that they need and modify these balancing postures. So you want to be mindful with especially challenging balancing poses and inversions at this point. We will talk a little bit more about inversions at a later point. Now, as the belly is growing, they will also need a wider stand. So especially in standing forward folds, such as Uttanasana, and in downward dog, they will just go wider with the feet than a hip width distance, so that there is space for the belly. Also in seated forward folds, they would just bring the legs further apart. So again, it will feel natural for them to do that, but it's great letting them know that they can always come into a wider stand. In the third trimester, the last 3 months, the baby will start moving a lot and it will start putting a lot of pressure on the bladder. So this is the time where they will be running to the toilet a lot. At this point, you also want them to guide them to lay on the left side for Savasana. And the reason for this is that we have a major vein that brings oxygen to the mom and the baby, and that runs through the right side of the body. So when we lay on the left, that can just freely flow, where if we're laying on the right, sometimes it can put pressure on this. That being said, I was sleeping a lot on my right side during my pregnancy as well, and I'm totally fine, but it's always great to guide them to lay on the left. And at this point, the goal of the practice is a lot more relaxation and more of a meditative and restorative practice. So at this point, we're focusing a lot less on strength, but a lot more on relaxation, and the woman will be feeling more tired again. So this is really what they need at this stage. At this point, they will also be using plenty of support. The more the better. Also in the second trimester, again, encourage them to use as much props as needed. Usually I always have them bringing 2 bolsters at least and a couple of blocks, so that they have it accessible and near them at any time they need it. And they will be feeling a lot more tired and they will need more rest at this point. Belly is getting bigger. They might be experiencing having water in their body, and this tiredness is coming back just as in the beginning of the pregnancy. Yes, so that is the different trimesters that the woman goes through during pregnancy. I usually see women coming in the second trimester for open level classes. This is the stage that they are feeling more energized, the stage where they can do pretty much everything, just avoiding laying on the belly and being a bit more gentle in the practice and laying on the left side for Savasana. But we will go through also some important points to avoid in general. So we want to avoid deep and close twists, so anything where you're twisting towards the leg. So imagine that you have a pregnant belly, and if you're having a close twist, you're kind of twisting towards the leg, so creating less space. There won't be space for the belly. And if you're doing an open twist, you're twisting away, so still getting a bit of that rotation in the spine, but still with space for the belly. So this will be demonstrated at a later point after this presentation. We also want to avoid deep back bends, so like wheel and other really deep back bends that doesn't feel comfortable. It can compress the growing uterus and it just doesn't feel very comfortable. So when we're pregnant, it's also really tuning into what is beneficial for me at this point. I might be able to do some of these posture, but why? At least it's how I felt in my pregnancy. I felt a lot less need for doing fancy and deep postures, but just getting moving instead. Then we want to avoid prone postures that are compressing the belly after 16 weeks, generally speaking. So again, laying on the belly on the mat, we will avoid after this point. Then typically speaking, I guide my students to avoid inversions. If they have a really strong practice, they can still do inversions, but it really is their own responsibility and not something I will encourage. If they choose to do this, I guide them to do maximum 30 seconds, as inversions do decrease the blood flow to the uterus when we're turning upside down. So this actually is also when we're coming into a downward facing dog, since all postures are inversions if the heart is lower than the hips. So I won't have them holding downward dog for longer than 30 seconds either. I want them to avoid intense core work as well after 20 weeks, but instead we will be doing some stabilizing core exercises such as balancing table, which is a really great postures, but we won't be doing any crunches or these even from earlier on. Again, it goes back to what are the benefits. The body is preparing for the growing baby and the abdominals are separating, so it's not the time that we want to work on this area of the body. But stabilizing core exercises are actually really important. We want to avoid hot yoga. One of the reasons for that is of the hormone relaxin, which makes it more possible to overstretch, and also just due to other factors, I don't typically encourage students to do hot yoga, but again, if they feel comfortable doing so, and it's not a very hot room, but just slightly heated, I will invite them into the practice, but just keeping these things in mind. We also want them to avoid laying on their back after 20 weeks and avoid deep stretching, and then they also want to avoid breath retention. So pregnant women can really benefit from doing pranayama, different breath exercises. It can really help them, and also through childbirth. But any pranayamas where we are retaining the breath and we are holding the breath, we want to avoid. They can still do it, but just for example, alternative nostril breathing. Sometimes we will add in a hold in between the right and left nostril. We just don't want to do that with pregnant women, so they would just continue breathing. Then there are some poses that we want to avoid. Revolve standing postures such as triangle, side angle, and half moon. So it's basically these postures but twisted, as that just doesn't feel right. It's a quite deep twist, and deep and close twists. So, for example, Adho Matsyendrasana, which is a half Lord of the Fishes pose, we will avoid the closed twist, but it's fine doing the open one. Deep back bends such as wheel, bow, locust, and deep camel. So especially bow and locust, we will avoid them all together, as they are really, the foundation is really where the baby is growing, the uterus is growing. So just take them, those two postures, bow and locust, out all together. We also, of course, avoid any other postures where you're laying on the belly. Arm balancing postures such as side crow, which is also a twist, it's impossible, and crow and 8-angle posture, and just other challenging arm balancing postures. They can do it at the very beginning, but often they won't really feel like doing any of these challenging postures at that point. Also, any balancing postures where you have the chance of falling is of course a no-go. Downward dog more than 30 seconds as it decreases the blood flow to the uterus. Front or back laying postures after 16 to 20 weeks. So that would be something like cobra, baby cobra, and savasana. And inversions, headstand, handstand, forearm stand, shoulder stand, and plow pose. I usually don't encourage students to do inversions. I have a pretty strong inversion practice, and I didn't even feel comfortable doing these postures throughout my pregnancy. I just didn't feel the need for it. But one inversion I love to do, and I would almost do it every day, was legs up against the wall. So that is a great alternative to give your students if you're having an inversion in your open level class and you want to give them something else instead. Legs up against the wall would be a great place to start. So instead, you want to focus on opening the hips. That can help prepare the woman for childbirth, strengthening the legs, especially during the second trimester. So a lot of these standing warrior postures are really great, strengthening the lower back and stabilizing core exercises. It's also great to include some lateral stretching, so opening the side body, just like the picture on the presentation, some pranayama and some meditation to really connect with the changes happening and the growing baby, and relaxation. It could be some yoga nidra, some guided visualizations, and just some gentle movements with the breath. So we will also go over some poses that are really great to include, that you can offer your students maybe instead of some other postures in your open level classes. So pranayama is great to especially include a ujjayi breath and the moon piercing breath. So the moon piercing breath is when you breathe in through the left nostril and exhale through the right. Breathe in through the left, exhale through the right. Cat-cow, so it can either be from tabletop, or it can also be doing these movements with the spines in, for example, a seated posture as well. So just having these small openings of the chest and rounding of the spine, moving with the breath. So other postures that are really great to include will be externally rotated standing postures, such as a warrior 2, triangle, side angle, and half moon with support if the balance allows the students to work on this. And also neutrally rotated standing postures such as warrior 1 and 3. Warrior 3 can be challenging with the balance, so here it's always great using either a chair as support or 2 blocks. Generally speaking, then, the externally rotated standing postures are easier than the neutrally rotated standing postures, as there is more space for the belly, so they are really great to include, but so are the neutrally rotated postures as well, just a little bit more challenging. Some other postures that are really great to includes hip openers in general, yogi squat or malasana, and goddess pose. And legs up against the wall, as I briefly mentioned, is a great alternative to other inversions, and it feels really great during pregnancy. Here you can also have the pregnant woman having a bolster behind her back, so she gets her chest lifted a little. That might make her even more comfortable. Wide-legged child pose, bound angle pose is a great forward fold. You can also give it as an alternative to other seated forward folds, as here she has plenty of space for her belly, and she's also working on opening the hips. Bridge pose is great for supporting the lower back. Balancing table as stabilizing core exercises, and heart melting posture as an alternative to cobra or other back bends. It can be used in sun salutations as well as an alternative to cobra or upward facing dog. Other postures, wide-legged forward fold is really great as well. Again, there's space for the belly. Head to knee forward fold is great as well. Here you can even open up the leg a bit to the side, and heart openers feels really good as well to open the front side of the body. Some women will end up with a bit of a rounding in the back due to the extra weight, so it can be nice to really work on opening the chest, and then doing these side stretching feels really good as well. So a few other tips. A pregnant woman can use a chair or a wall for support, especially when working on balancing postures. And then it's always important to encourage pregnant women to be guided by their own comfort. So this is a great tip that you can give any pregnant woman coming to your open level class, to really tune into what feels right. And if there's something that they are just slightly unsure about, it's a lot better to just skip it and leave it out. Some great cues for pregnant women can be to lift the baby from beneath or hug the baby in, which helps to engage the core and the pelvic floor and create stability in the different postures. So it's a similar cue that we will give in a general yoga class, would be bringing the belly in and up to create that engagement. Of course, in open level classes, you might not want to use that, but it's good for you to know. So pregnant women can also benefit from doing pelvic floor exercises. This is also important after pregnancy, but it's also really great to do prior. And this can be done doing the yoga practice itself in the different postures, both laying down, seated, and standing. So some women will also experience having sore and painful wrists. So here you can give them other options, such as coming down to the forearms or making a fist. So anything that can kind of help them release the pain in their wrists. It can also be just making sure to warm up the wrist with maybe some circles. And a big one is sacroiliac joint pain, SI joint pain. And a lot of women experience this kind of lower back tension, and it's due to the hormone relaxin, and that can be one of the reasons that everything gets a little bit more loose, and that can cause pain. So great postures are the stabilizing core exercises as balancing table, also doing a bit of stretching such as forward fold, legs up against the wall can help release it as well, and also bridge pose is great for building strength in the lower back so that you can better support the growing belly. And another prop that can be really great for pregnant women is using kind of like a yoga, fitness, Pilates ball that they can sit on, and they can do some balancing postures, they can do some hip circles and stabilizing core exercises as well. So some other postures that are really great to do as well for pregnant women, that can be modified side plank, it can be standing balancing postures such as tree pose, and these postures are also stabilizing core exercises that can really help the woman through pregnancy. So I hope that you feel just a little bit more prepared if you have pregnant women coming to your open level classes. You can of course dive a lot deeper into prenatal yoga, so this is just an introduction with some general knowledge so that you feel a little more prepared and know how to help them modify the practice in your open level classes. So we are also going to briefly talk a little bit about postnatal yoga, as you most likely will also experience having women coming to your open level classes post-birth. So postnatal yoga is a gentle form of yoga for post-pregnancy. The practice addresses the challenges of being a new mother and the aftermath of pregnancy. So the first 3 months after giving birth is often referred to as the fourth trimester. I usually recommend my students to wait at least 4 weeks until doing any form of exercise. The first thing that they can start with doing is just doing some deep belly breathing and connecting with the pelvic floor. Open level classes, I would usually recommend women to wait at least 6 weeks, but generally speaking, 8 weeks or even more. It of course also depends on the type of class that you are teaching. If you're teaching restorative yoga or more gentle forms of yoga, it will be more suitable for post-pregnant women. So at this point, women will be experiencing a lot of emotional changes and challenges, and they will most likely be sleep deprived. They will also be facing a lot of changes to the body in their phase after giving birth. So pelvic floor exercises are really great to do at this point. The pelvic floor is weak after delivery, so that is really important and can be incorporated into the yoga practice itself. Of course, are you teaching open level classes, you can maybe just give them these tips on a one-on-one so that they can bring it in to their own practice. They might be experiencing sore shoulders from breastfeeding or bottle feeding, and they will have a weaker core, and some women might also be facing a abdominal separation, which is called diastatic recti. So always remember to give the body time to rebuild after childbirth. So open level class is a minimum of 8 weeks, but typically speaking even longer. So the women who have a C-section recovery will usually need a little bit longer time to recover. So they have just gone through a rather big surgery, and the scar needs time to heal as well. The woman, both after a C-section birth and a vaginal delivery, will experience bleeding up until 2 months after as well. It can be great to start with some modified core work, so very simple exercises. Heart openers and restorative postures are also postures the woman will really benefit from. Again, these sore shoulders from carrying around the baby and most likely rocking the baby as well. So it can be really nice doing some openings for the chest. And then just working on slowly rebuilding strength, but taking all the time that the body needs. There really is no need for rushing into a recovery. I always encourage my students to take all the time that they need and to not worry too much about having to build up their core strength really fast and quickly after and get back to their old body. They will also most likely be experiencing sore breasts if they are breastfeeding, so it can be even uncomfortable just laying on the belly sometimes. And other places they will typically be feeling tension is in the neck, shoulders, and lower back due to the weak core. So in postnatal classes that are specifically targeted to women after birth, there will sometimes be classes for just the moms, but often it will also be mom and baby classes, which are really great. So I absolutely love teaching these classes. We don't get to do that much yoga, but we get to do a little bit, and the women bring their babies along. Some of them might be sleeping and others might be crawling around. And as you can see on this picture, it's me holding my son. I think he's around 6-7 weeks at this point. And also, again, here a fitness Pilates yoga ball can be a great prop for women to use. So again, when women are coming post-birth to your open level classes, it is not your responsibility to give them all the guidance that they need. Then they need to go to a specific postnatal yoga class where the teacher is certified to teach this. But you can give them some general tips and advice, and it will be to again be guided by their own comfort, and encourage them to wait until 8 weeks until they start a yoga practice, and especially open level classes, and then also have them being gentle to themselves and maybe joining in on some restorative or some yin classes. So if this is something that you would really like to dive deeper into, we are offering a 50-hour online pre and postnatal course where you can get certified to teach pre and postnatal yoga. It is registered with Yoga Alliance as continued education, so a course that can be completed after having done the 200-hour foundation course that you are doing right now. So I hope that this little presentation leaves you feeling a little bit more prepared. Also, if you have women coming to class post-birth, they might not always let you know, but if they do, you will know what they can and cannot do at this point. Action steps. So start with practicing 3 rounds of your sun salutation A with a blanket or bolster or pillow as a pregnant belly. Then go through the prenatal sequence also with a blanket or something else as a pregnant belly. So this will give you a feel for what pregnant women might be experiencing and how you need to modify the practice, such as widening the stand and adding in a heart melting posture instead of a cobra, and just in general how it would feel being pregnant while doing yoga. And at the end, answer the assessment questions.